Hi, my name is Elizabeth Hart. I'll be doing the ear, nose, and throat assessment.
My name is Michelle Hart, and I consent to be recorded.
Okay, when you first start off the assessment, you're going to gather your subjective data from the patient. In this assessment, I'm going to specifically start off by asking the patient, do you have any trouble hearing now?
No.
Since the patient has no trouble hearing, I'll proceed with my normal assessment. If the patient did have trouble hearing, then I would stop my assessment and then first do my hearing acuity test. First, I'm going to look at the patient's ears, noting the symmetry on the head. And then I'm going to further inspect, noting the color of the ear, if the skin is intact, if there's any lesions noted. The skin of the ear should be the same color as the skin on the patient's face. Next, I'm going to note the tenderness of the ear. You would pull up and back and press in on the tragus. It should be firm and the patient should feel no pain at this point. Next, I would note the external auditory meatus, looking for there's no swelling, discharge, redness present at this time. I would then take my otoscope and position to see the eardrum, note any redness, swelling, lesions, foreign bodies in the ear. Then I would inspect the tympanic membrane, noting the color and characteristics. The normal eardrum should be shiny and translucent. Next, we're going to do the hearing acuity test. The patient has no difficulty hearing, so we'll continue on with the whispered voice test. At this point, I'd ask the patient to stand up, turn around, and stand about 2 feet away from me or arm's length away. At this point, you would pick a random set of 3 numbers and letters and ask the patient to repeat them to you when you say them in a whispered voice. They would cover their one ear at each time, so covering the right ear, you'd pick a set of 3 numbers and letters such as 42K. The patient would repeat it to you and then cover the left ear, and you would pick another set of numbers such as G37 and have the patient repeat that to you as well. You can turn around and sit down. At that point, I would then perform my tuning fork test. Next, after the tuning fork test, I would perform the Romberg test. The patient would then stand up with their feet close together. You'd ask the patient to look at you with their eyes open first, noting that there's no swaying in the body movement. And then you'd ask the patient to close their eyes and note that there's no swaying in the body as well. To test the Romberg test, you would note how long the patient can stand there with their eyes closed without any swaying. A positive Romberg's test would be the patient is swaying and noting a change in stance. Negative Romberg test is just as we see here, the patient has no deviation in movement. You can sit down. Next, we're going to do the nose assessment. Looking at the patient, you're going to assess the symmetry of the nose, noting its midline on the face and proportional to the facial features the patient has. Next, we're going to assess the patency of the nostrils, closing one nostril at a time, having the patient blow out, and then the other nostril, having the patient blow out. Then we're going to inspect the nasal cavity with the otoscope, noting any swelling, discharge, bleeding, or foreign bodies in the nose. You're then going to palpate the sinus area. I'm going to take my patient's glasses off first. Taking your 2 thumbs, pressing upwards under the eyebrows, feeling for any tenderness or swelling of the area. Moving on to the mouth assessment, you look at your patient's lips, noting the color, moisture, cracking, any lesions on the lips, and then move on to the teeth and gums. Looking at the teeth, you ask the patient to just smile, noting that they are white, evenly spaced, clean, no signs of decay. Then, to look at the gums, you would just pull down and note that they are pink in color and no lesions as well. Then, to look at the tongue, we ask the patient to open their mouth and stick their tongue out, noting the color of the tongue and the moisture as well. You would then ask the patient to touch the tongue to the roof of their mouth, noting that it's shiny and you can see the veins on the bottom of the tongue and smooth. You would then also inspect for any white patches or lesions inside the mouth at that time. You can do so by taking your hands gloved and a piece of gauze and adjusting the tongue to either side of the mouth. to note any white patches or lesions inside. At that same time, I would then take a tongue blade, go inside my patient's cheek, pull out, and assess the buccal mucosa, note the color, any nodules, and lesions as well. Then, lastly, we're going to inspect the roof of the mouth, taking your light, pen light, and so you shine the light on the inside of the roof of the patient's mouth, noting that it's smooth, looking at the texture and characteristics. Then you inspect the last part, the back of the throat. The patient here has no tonsils, so you wouldn't note any size grade of the tonsils. But looking in the back of the throat, you see the uvula is midline. And to rate a patient with tonsils, you would say 1+ is visible, 2+ is halfway between the pillars and uvula, 3+ is touching the uvula, and 4+ is touching each other. In a normal patient with their tonsils, they would be 1+ or 2+. In this assessment, the patient appears to have a normal assessment with no abnormalities in the ear, mouth, nose, or throat.